Hello and welcome to this month's Hot Topic podcast. This is Sherry.
Hi.
I'm Matt, and today we're focusing on the essential aspect of patient safety and care, the prevention and management of pressure ulcers.
Ooh, what is a pressure ulcer, Matt?
Thank you for asking, Sherry. Pressure ulcers, also known as pressure sores or bed sores, are painful, distressing, and often preventable. This session will give you essential practical steps to protect our patients and improve outcomes.
That sounds really interesting, Matt. So where do we start?
Assessment. Assessment is the starting point for prevention. Use the Purpose T pathway to guide risk assessment and always hand over where the patient sits on the pathway, including when they were last repositioned. This ensures continuity and prioritisation of high-risk patients. Simple visual tools like care colour circles support quick communication between shifts.
So, I guess part of that assessment process is ensuring that we're doing our regular skin checks. These are essential in terms of our skin surveillance. We need to make sure that we're checking not only our visible areas, but also under our medical devices, such as oxygen delivery devices and our catheter tubing. And when you're checking your catheters, please ensure that you're checking those mucosal areas also. We need to utilise our look, listen and feel approach when we are assessing our patient's skin. So we're looking for any non-blanching redness, any discoloration, any vulnerable or fragile skin, and any moisture damage. However, please be mindful that in our patients with darker skin tones, these changes may not be quite so obvious. And this is where our listening skills come in. If your patients are telling you that they have numbness or itchiness or pain in any of their pressure areas, please take these concerns seriously. Remember that early inspection means early detection, and quick actions can stop small problems becoming major.
And Sherry, how do we recognise these changes?
I'm so glad you asked, Matt, because we've brought some examples along with us today.
We do. First off, we have vulnerable skin. This is formally known as a deep tissue injury.
And here we have a category 1. These, you'll notice, have non-blanching redness.
Then we have category 2. You will notice the decreasing damage to the skin tissue.
And here we have a category 3 where you can see that this has deteriorated further.
Category 4, you can see the increased cavitation of the wound and skin discoloration around the edges too.
And finally, we have our necrotic wounds. These are a bit of a mystery until they're debrided because we don't know what's under them. So we need to ensure that we're datixing these as a category 3 as a minimum. But this can always be amended by the tissue viability team once they have assessed.
You may also encounter blisters. These should be treated as either as a category 2 or a category 4, and perhaps most importantly, the blister left intact. Do not pop it, it's the body's natural way of helping protect itself.
That was great, Matt.
Thank you,
How do
Sherry.
we look after our skin?
Healthy, well cared for skin is stronger and more resilient. When washing the skin, use octenisan correctly. Apply it to a wetted dry wipe and apply and leave for 2 minutes, then rinse off thoroughly before moisturising. This is especially important for patients with dry skin. Moisturising afterwards helps protect against skin breakdown.
Do we have products that we can use to moisturise, Matt?
We do, Sherry. Thank you for asking. We have products like the Epimax cream. We also have barrier sprays such as the Cavalon spray and the Derma S spray as well. These are essentially the same product and can be used as appropriately.
So how often per shift should we be using a barrier spray?
For barrier sprays such as the Cavalon and the Derma S, once daily is enough. If the patient does, however, have issues with incontinence, wound leakage, or other issues that may damage their skin integrity, then it may be appropriate if you're washing and drying the skin frequently to apply the spray more often.
That's great, Matt. I didn't realise that there were times that we can use it more often.
Thank you.
Thank you for that.
Also, support hydration and nutrition. These are key for skin health and for healing as well.
That's brilliant. So we've assessed our patient's skin and we've noticed that there is a skin injury there. So how do we document this? So firstly, within our nursing notes and our body maps. The most important thing is our medical photography. This is our evidence of these injuries that these patients have, and this must be done on admission. We also need to continue monitoring with photography during our patient's stay. This is so that we can monitor any progress or deterioration of the wound while in our care. And most importantly, please ensure that you are doing this photography when patients are discharged. This creates clear records and it safeguards both patients and our staff. And remember to always Datix any of these skin injuries. Please ensure that you follow our trust policy on consent, confidentiality and secure storage. And this means not using your own devices to take medical photography.
Thank you, Sherry. Documentation is vitally important for our patients. The next section is moving. Movement is our strongest tool to prevent pressure ulcers. Follow repositioning schedules based on the patient's risk. Red pathways every 2 hours. Amber pathways reposition every 4 hours. Use clinical judgment and adapt when needed. When repositioning patients, use appropriate manual handling tools such as the sliding sheets. They are there to help prevent injuries to the patient and to us as well. For offloading, use pillows, repose wedges and KeraPro. Footstools help offload heels and also elevate legs while the patient is sitting. And remember, all you have to do is ask. Patients often can and want to help with their movement when supported in hospital.
That was great, Matt. Really informative. And I was thinking as you were talking that actually keeping our patients moving can help prevent deconditioning when they're here with us as well. So that's an added bonus, guys. So I guess to sum up, preventing pressure ulcers really comes down to consistent, simple approaches. Assessing our patient's skin integrity, regular and thorough skin checks, including under medical devices, keeping our patients moving, good skin care, and the use of our medical photography. Yet together, these actions reduce risk, strengthen our culture of prevention, and improve our patient outcomes.
Thank you, Sherry, and thank you for watching this month's Hot Topic podcast. And remember, prevention is better than treatment. Please keep your eye out for our next Hot Topic podcast.